see the capillary, yeah, the supporting cells, mesangium, and here you see some podocytes, and what is this space? Bowman's capsule, and here you see the parietal cells, yes? Okay, so in lupus you may see deposition of immune complexes in different parts of glomerulus. For example, in mesangium, beneath these podocytes, or for example, beneath the basement membrane of the capillaries and these places, okay? For example, here the first class is minimal mesangial lupus nephritis. You see here the position in mesangium, okay? The supporting, matrix and cells of glomeruli, okay? And in class 1, you don't have much symptom, and you have, the changes in structure. Hello, listen. What are you talking about, by the way? Listen, I'm going to finish soon. And, we don't have many symptoms, and we don't have changes in light microscopy. We only have changes which are detectable by electron microscopy, okay? In class 2, we have mesangial proliferative lupus nephritis, or class 2, which we have, in which we have mesangial cell proliferation and expansion of mesangial matrix. So we have mesangial involvement, and we do not have capillary involvement, okay? And in class 3, we have focal lupus nephritis. We have changes which involve less than 50% of glomeruli. And what are the changes? We have proliferation of both endothelial cells and mesangial cells. So in mesangial class 1 and 2, the capillaries were not involved, but in class 3 and 4, we have involvement of capillaries. We have proliferation of endothelial cells, okay? And class 3 is focal, okay? But class 4 is diffuse. It means that it involves more than 50% of glomeruli, okay?
3 and 4 change in what?
Sorry?
1 and 2, there is no changes in what
capillaries.
Is capillary.
We have changes in mesangium, but 3 and 4, capillaries and mesangium, okay? And class 5 is membranous lupus nephritis, which involves capillaries only, okay?
Type what?
Capillaries.
No, which type?
5.
5.
And class 6 is the most severe one, in which we have advanced sclerosing lupus nephritis. We have sclerosis of more than 90% of glomeruli, and the kidney loses its function. Okay, so in lupus, we also have manifestations in skin. For example, as I told you, we have butterfly rash or malar rash, and we may also have symptoms in joints. For example, we have arthritis, we may have symptoms in CNS, as I told you, and in serosal surfaces, okay? One of the important symptoms in lupus is symptom that is related to cardiovascular system, okay? We may have different types of cardiovascular symptoms in lupus. For example, we may have myocarditis, or we may have coronary artery disease, and sometimes we have involvement of valves. Yes, and we we have deposition of immune complexes on leaflets of cardiac valves. This is called Liebman-Sachs endocarditis, okay? Which you see here. You see, these are the deposits on the surface of leaflets. And we have two different types of lupus. One of them is chronic discoid lupus erythematosus. In chronic discoid lupus erythematosus, we have the skin manifestations, but systemic manifestations are rare. Okay? So if we have a patient with skin manifestations, it is called discoid lupus erythematosus. And 35% of these patients have positive INR. Okay? But positivity of double-strand DNA is rare in these patients. And you should know that some patients, about 5 to 10% of these patients may progress to SLE in a few years. Okay? And another type of lupus is subacute cutaneous lupus erythematosus. It is something between discoid lupus and SLE. Okay? The skin manifestations are more widespread and they are superficial, but for example, the systemic manifestations are mild. Okay? And also we have drug-induced lupus erythematosus, which is caused by, for example, as I told you, vitrolazine, procainamide, isoniazid, and D-penicillamine. We also have positivity of INA in drug-induced lupus, but a special and a specific antibody in drug-induced lupus is anti-histone antibody. And what is the treatment of drug-induced lupus?
You should stop.
Yes, that medication, yes. And that is all. Thank you very much. We have some questions here which you should study at home. And I'm sorry because
The last picture, what was it?
Sorry?
The last picture, the microscope.
On our rush. Oh, it was a gland which is in the form of a heart.
This is nephritis?
No, not nephritis. I think it must be related to endometrium.
Endometrium.
Endometrial gland. This is normal.
This is normal.
This is normal, but it has taken the form of a heart.
Oh, good. Romantic.
Yes.